Obesity in America is leading towards an epidemic, and as many people know, the new GLP-1 medications are being used to help combat that as well as other chronic conditions.
If you've heard about them but wanted to understand a little bit more about whether they're right for you and what you can expect, we have the CEO of UBI Telehealth, Nima Mowzoon, here to share a light on that. Good morning.
Good morning. Thank you for having me.
Pleasure.
Yes. Well, we already mentioned the GLP-1 medications. In a nutshell, what are they and who are they really benefiting right now?
Yeah. Thank you for having me here. So the GLP-1 medications are a group of medications that have been out in the market for a very long time. They are benefiting your consumers, your regular day Joes who really just want to lose some weight, and they just hit a wall. They just, that appetite is there. And no matter how much they modify their diet and their exercise, they're pedaling faster and they're just not getting it. So it really is a very good tool to reduce your appetite. And that's really what it needs to be looked at as a tool. It doesn't replace your lifestyle modifications, your diet and exercise, but it's a very good tool.
Yeah, I think one of those things that you often hear is, or people expect, is that they take the injections or however it's administered and you just shed the weight. So, I mean, that's a myth. One of them. Are there any other common myths that surround this medication that have just ballooned out of proportion?
Yeah, no, that's exactly right. I mean, the biggest myth is that, and we educate the patients. Don't expect to go on this and 2 months and then you're good. Now, the way that myth came about, by the way, is we do see 20% of patients or less that do get significant weight loss right at the beginning, and we're very careful with those patients. We don't bump them up. I mean, we really start very slow, and we don't bump them up as quickly as some of the others. So now what happens is with a lot of these vendors, they look at that patient and they bring that patient on to your social media, and that patient will testify, look, I just lost a significant amount of weight in 1 month. So now everybody thinks that that's what's going to happen to them. So that's in fact not really the case. So, and then the other big myth is exactly what we said. People try to think of this as a magic bullet. Why do I have to go to the gym every single day and work out in this, where I could just take a shortcut and get well and get healthy? And that is really just not how it works. It's really not very healthy for people to try to replace their lifestyle and nutrition and that, because there's there's essential fatty acids, there's good protein that our bodies need that your body cannot make. So it's dangerous just to replace your good nutrition and diet and exercise with these medications. So that's the other myth.
That's good advice.
Nima, as a medical provider, do you have any advice for viewers watching, or just something you would want them to know when it comes to this medication?
Well, I think the most important thing is to identify, number one, you need to work with this medication as a tool. It's not going to replace everything for you. And you need to understand that this gives you an opportunity to change your lifestyle, to shut off that food noise, to even shut off the alcohol noise, and to get your weight onto good, healthy lifestyle. Once you change your lifestyle and you acclimate to that change, stay with that. Even if you come off the medication, if you rebound very quickly to your old habits, well, guess what? The weight's going to come right back. This medication gives you a temporary opportunity to shut off the noise, to shut off the appetite, and to get you on a healthy path. People have to use that.
Yeah.
For viewers watching at home, who would you encourage, or who do you think is an ideal candidate for this kind of medication? Is it purely for people suffering from certain conditions, for people who are desperate to lose weight who can't? Who fits the mold and who should be considering taking this?
Because the medications came out first for diabetes, everybody thinks that it's just for diabetics. But as a matter of fact, the weight loss is outside of the benefit for diabetes. So I think anyone that has a BMI of over 25 would be a candidate for this. And so when you are the patient that qualifies for obesity or overweight, you would qualify for this, but it needs to be monitored, and it needs to be monitored by a physician.
Yeah, very important.
Yeah. Well, you didn't just come with insight, you also came with a special offer. So what is that?
Well, we like to offer for all your viewers here in Nevada and all the surrounding area a special code, WELCOME20, WELCOME20, so your patients, so your viewers can go on the website, and very easy to sign up. They answer some questions, they get in touch with the physician will talk to them, and that's it. They put the code in there and they get 20% off.
It's great stuff. Thank you so much.
Yes.
UBI Telehealth is currently offering $20 off your first order when using the code WELCOME20 at checkout.
To take advantage of that offer and to learn more about their array of services, just visit ubitelehealth.com.